Pelvic tilts are a great tool when dealing with low back pain, and learning how to use this tool to correct posture can help with your lifts and everyday movement to help reduce discomfort in the low back. Using pelvic tilts as an exercise teaches your body to come out of an anterior pelvic tilt, which is common in people who sit a lot. Having weak core muscles and tight hip flexors can contribute to having an anterior pelvic tilt and low back pain. Once you've mastered the pelvic tilt, it's time to move into glute bridges. Use the same pelvic tilt and press your low back into the floor before squeezing your glute muscles to lift your hips off the floor. You should feel your core muscles engaged at the top of this lift. If you are lifting too high and not doing the exercise properly, you will see the back arch at the top of the movement. Find your happy medium to ensure you practice this movement correctly. Now that you understand pelvic tilts and glute bridges, you can now practice planks and good plank posture. Start with your shoulders in line with your elbows as you lift the hips off the ground. Your feet are about shoulder width apart, and you're focusing on that pelvic tilt for good posture in the low back. Do not lift your hips too high or drop them down too low, as this can cause more low back pain and improper posture. Your core muscles should feel strong and engaged while your glutes are squeezed and all other muscles are tight. Practice these movements to help reduce low back pain by strengthening and engaging the correct muscles needed for good posture.